Let's see how the Multiossigen Medical 99 IR device works. Inside the portable case, we find a power cable to plug directly into the machine. Starting the machine, connect the power cord and insert the dry plug into the wall outlet. Turn on the device using the green button 01, setting it to 1. The display will show "Warm up, please wait." The equipment's heating process will take about 5 minutes. While waiting, you can install the pressure reducer to prepare the device for use. When the display shows Multiossigen Medical 99 IR, the machine is ready to use. Press the black button once to access the machine's operation menu, selecting the oxygen source. On first startup, the machine will ask you to select the oxygen source to use. Internal. Oxygen comes through an attachment connected to the machine. External. Oxygen comes from an external source like a cylinder with a pressure reducer. Use the yellow button to navigate options and enter to confirm your choice. Program selection. After choosing the oxygen source, you'll enter the program menu. There are 10 programs, each with a preset ozone concentration. Use plus and minus keys to scroll through programs and select one. Programs are editable, but preset concentrations usually suffice. Adjusting the operating pressure. Before proceeding, adjust the machine's operating pressure. If pressure is incorrect, the machine will automatically lock. Use Allen key or knob to adjust pressure to 0.45 bars, just under 0.5 bars. Start ozone production. Select program 725 mg/ml or your desired program. Press enter quickly to start the machine and ozone production. The machine will go through several automatic phases. Ozone preparation and extraction. At 25 mg/ml or desired level, the machine stabilizes production. Preparing the syringe. Open the extraction valve. Place a screwless syringe perpendicular to the valve. Help the syringe plunger rise to draw in ozone. Once filled, attach the treatment needle to the syringe. Stopping ozone production. Press the black button once to stop ozone production. Wait 30 seconds without touching anything. This cleans internal ozone, preserving machine function and safety. Accessories. The machine has a continuous sampling valve for treating local wounds, ulcers, and diabetic foot. Once running, place the valve on the sampling port and press to start filling the bag. Discharge the cylinder at day's end. After patient treatments or at day's end, depressurize the cylinder. Press the blue O2 button to flow oxygen through the machine. This will release the reducer's residual pressure. Monitor the pressure gauges. Wait for both dials to reach 0. When both gauges read 0, stop oxygen flow by pressing blue O2 again. This safely shuts down and fully flushes the machine with oxygen, cleaning the internal circuit.